Hello, everyone. Happy Wednesday. So excited to have you here. My name is Jennifer Bonner. I am the manager of nursing services here at Archer Review. I've been a nurse for over 15 years, over 16 now, and I am a certified nurse midwife. So, one thing that we hear quite a bit here at Archer is that, hey, Jennifer, I'm really struggling with pharmacology. Anybody in that boat? Let me know. Raise your hand. You can post it in the chat for me. Let me know if that is you or you are struggling with pharmacology. Okay, I'm seeing some yeses. I'm seeing some hands raised. Okay, so this is going to be an opportunity for us to go through some pharmacology, but I also have a few let's say special guests along the way. I want to tell you about a neat offering that we have for you if you are struggling with pharmacology. So stay tuned as we go through some of these medications. So right now I am in South Dakota. It is beautifully sunny out today, but I'm curious, where are you joining me from? So let me know in either the webinar chat, if you're joining us on TikTok, YouTube, Facebook, Instagram, let me know where are you joining us from. Okay, I'm seeing Orlando, Florida, seeing California, Brampton, Texas, New York City. Let's check where everyone is joining us from here. California, Pennsylvania, Oklahoma, Canada, India, Australia, Tennessee, Zimbabwe, Maryland. Lots of you joining me. And so I'm really excited to have you. Seeing a few more from Texas. Someone said it's a little cloudy and gloomy. I'm at the library window side. I love studying by the windows. That is one of my very favorite places to be. I love to see what's going on outside. Ghana, Philippines, welcome. I'm so excited to have you joining me. We have a action-packed time together today that I'm hoping is going to help you feel more confident in your studies in pharmacology in particular. So, if you are someone that struggles in that area, I'm hoping you will just kind of hang on with me. I'm hoping that you'll feel more confident at the end, at least have some resources. So, when it comes to pharmacology, a lot of the time, what I like to know is how do I study pharmacology? There's a lot, right? There's so much that we need to be paying attention to. And I like to study these medications with whatever specialty area I'm in. So if I'm looking at maternal child today, then I'm going to start looking at those oxytotics. I'm going to be looking at what's stimulating contractions, what's making contractions go away, what medications am I going to use for hypertension, things like that. And so in that way, it's not a whole, like a big list that we're trying to figure out. It's just what is applicable to the areas that I'm studying. And so if today I'm looking at diabetes, then I'm going to start looking at the insulins, things like that. So I'm hoping that that will be helpful for you as you move through the information. So we are going to start with the endocrine system. Okay, are you ready? So what I'm going to do is I'm going to give you a little bit of a descriptor about these medications and we'll see if you can guess the medication. Okay, are you ready? Here we go. This is a hormone created by our pancreas that controls the amount of glucose in our bloodstream at any given moment. It helps to store glucose in our liver, fat, and muscles. Without this hormone, we can't store glucose in our muscle or liver, and we can't make fat. Instead, without this hormone that breaks down ketone bodies and causes our blood pH to drop to dangerous levels, leading to DKA. What medication am I? What do you think? You guys were jumping on that one rather quickly. Okay. Jump over to see what everyone is saying on YouTube and Facebook. A few of you joining me on Instagram. All right. Nice work. Many of you are getting this one. All right. So many of you got this one. I'm seeing lots of really great answers over here. So let's go ahead and see what our answer is. Drum roll, please. Here we go. Our answer was insulin. You got it. Nice work there. Insulin. So, insulin is one of the things that our body needs. Now, when it comes to insulin, and something that's really important is when you're thinking about the different areas that we can see this. One of those is in pregnancy, right? We have women who are gestational diabetics. And so, what's happening is during pregnancy, the mom is throwing out all this glucose to the baby, right? So the baby's pancreas is saying, okay, I can keep up with those demands. I'm going to make some insulin. And so what happens is once that baby is born, they have all this insulin in their body and they don't have all the glucose that they had before. So we can see some hypoglycemia in those newborns. So good reason why we need to check on them. All right, so keeping with that, let's talk about types of insulin. This type of insulin is the only type that can be given via IV push or IV infusion. What medication am I? IV push or IV infusion? There is only one type of insulin that we can do that with. What is it? I thought I was going to confuse you on that one. Okay, let's see how we're doing over here. Oh, few of you are having issues. Is everyone able to hear me okay? Okay. I'm not sure what happened here. Oh, okay. I'm not sure what happened there. I see a few of you asking me what had happened. Video is not running. Okay. Hmm. Sorry about that, guys. Okay. Let me hop out really quick and see if I can fix it for those of you who are on Instagram and TikTok. So many of you are getting this one, but you're right. The answer here is regular insulin. Now, regular insulin is the only one that we can use through the IV push. Very good. All right, this medication works by lowering levels of glucose in the blood. This is a fast acting insulin that starts to work about 15 minutes after injection and peaks in an hour. Okay, ooh, I'm seeing some back and forth here. Okay, so which one is going to work by lowering levels of glucose in the blood? Fast acting starts to work in about 15 minutes after injection and peaks in an hour. I love these types of games, especially if you're working on something that's a little more difficult, where you're trying to make sure that you have these things put together, is to put in kind of like a Jeopardy type game. So those are really fun. All right, well, let's go ahead and check out our answers here. How many of you said Lispro? Exactly. So it's that fast acting insulin. You got it. All right, nice work. Next question. This is a medication used to treat diabetes mellitus. It's categorized as an intermediate type of medication and has an onset of 1 to 3 hours with peak effect 4 to 8 hours. It is given subcutaneously. Okay, just making sure everyone's able to hear okay. I was able to get back in, so it took me just a minute. And unfortunately, we do not offer these slides, but the recording will be available to you on both Facebook and YouTube. And you won't be able to see everyone else's responses, and those are hidden for a reason. We want to make sure that you're able to think independently and you're not bombarded by everyone else's responses. Okay, I see a few of you going kind of back and forth. That's okay. Remember, this is a safe place to be able to um, just be vulnerable, try to figure out, okay, what is it? Here's what I think it is. Okay. So we use it for diabetes, intermediate type, onset of 1 to 3 hours. The answer here is NPH. Actually, I think all of you got that one. NPH is the answer here. Okay, so remember, I told you if you're struggling with pharmacology, I have something to tell you about, and that is our pharmacology crash course. Y'all, we have a pharmacology crash course coming up next week. It's Monday through Friday. It is 10 hours combined, 2 hours each night from 7 to 9 p.m. Central Time with the amazing Lauren Korth. Y'all, this lady has got some amazing farm ability. She is able to break it down in a way that's understandable, that's fun. It is a lot of information, but she's going to give you some kind of tips and tricks along the way. So if you're someone that struggles with pharmacology, this is a $75 offer. You can scan that QR code right there on your screen. It will take you to the booking link and you also receive the recording for this. And a lot of times, Lauren will share some flashcards, and also some tips and trick sheets. So if that's something that you're interested in, please don't hesitate. Go check out this offering. And yes, several of you have asked, is this lecture um, the pharmacology crash course is recorded and it is available if you just want to purchase the recording. So if that's something you're interested in, please go ahead, let me know, and I can drop that for you in the chat. All right, so let's go ahead and check out our next question here. So this medication is man-made form of the hormone insulin that works by lowering levels of glucose in the blood. The specific type of insulin is a long-acting form that starts to work several hours after injection and keeps working evenly for 24 hours. This medication can be used for type 1 or type 2 diabetes. Some great answers coming through here. Yes, I will drop that link for you for those who are just wanting the recording of that pharmacology crash course. I'm going to drop that for you here in the chat. Okay, I will put it in. All right, let's go ahead and check out our answer here. If you answered glargine, you are absolutely right. Glargine is the medication that we were after there. Nice work. So when it comes to insulin, um, I'm a visual learner, so I need to put things into tables. I need to write things out. I need to make pictures, that type of thing. So this is a really great way to kind of manage all of that information. So we're going to look at our different types of insulin. So rapid acting, short acting, intermediate, long acting. And then we're going to list. Okay, so my rapid acting, those are my things like Aspart and Lispro. The onset is really quick. It's that 15 minutes. They're going to peak anywhere from 30 minutes up to 3 hours, and then they're going to last anywhere from 3 to 5 hours. My short acting is my regular insulin. So remember, that's the one that we can give through the IV. Its onset is about 30 minutes. It's going to peak in about 2 to 4 hours and last anywhere from 5 to 12. My intermediate acting, I always think that has 3 syllables. So intermediate acting, 3 syllables, 3 letters, NPH. Okay. And so its onset is anywhere from 1 to 4 hours, going to peak from 4 to 12, and then it's going to last anywhere from 10 to even after 24 hours. And then my long acting is glargine. Long acting insulin is my glargine. It's going to have an onset about 2 to 4 hours. It doesn't have a peak and it's going to last me 24 hours. Now, when it comes to insulin, there's a few things we need to understand, not only how to give it, not only when to give it, but also how to store it. So, when it comes to insulin storage, there's a few things that we need to keep in mind. I want to keep it away from heat and direct sunlight. So sitting on my windowsill is not a good place to have my insulin. I want to keep it away from heat. So I don't want to put it next to my microwave. I don't want to put it next to my oven because my oven is going to be giving off quite a bit of heat there. Now, the other thing is, I want to store it in my refrigerator. I want to keep it cool. But if your refrigerator is anything like mine, sometimes, actually, just the other day, we had some lettuce that we used for tacos, and I put it in the back of my refrigerator. And guess what? It came out frozen. So we want to be really careful that our insulin is in a good place in the refrigerator to where it's not going to be frozen. And then once we get it out to use it and it's being actively used, we're just going to keep it out on the counter, just at room temperature, nothing too new, nothing too exciting. And then we want to make sure that we know how long is it good for. So we know in the hospital setting, we're going to get it out, we're going to date it, right? We're going to be using it pretty frequently. But at home, we want to make sure that they're dating it too, so they're not using outdated insulin. So NPH is good for a month. Our glargine is good for 28 days, and our rapid and our short acting are also good for 28 days. So round about the same, give or take a couple days there. But we definitely want to make sure that we understand how to store the insulin. Now, somebody tell me, how am I going to mix insulin, or what insulins might I mix? What insulins might I be mixing? Ooh, I'm seeing regular, I'm seeing NPH. Okay, so when it comes to mixing insulin, we are looking at regular and NPH. So there's a couple things that I want you to think about. We are going to first take our syringe and we're going to draw up the total amount that we need in air. Okay, so this is going to help us when it comes to that vacuum situation inside our vials. So if I need let's say I need 2 of regular and 2 units of NPH. I'm going to draw up a total of 4 units of air. Okay. And then I'm going to take my NPH vial. I'm going to inject the amount of air that I need. So if I need 2 and 2, I'm going to inject 2 units into the NPH vial. And then I'm going to inject 2 into the regular. And then I'm going to go ahead and draw up my regular insulin. So I'm going to draw up my 2 units. And then I'm going to draw up my 2 units of NPH. And a really good way to remember this is RN. I draw up my regular first and then my NPH. Okay. So that's how we're mixing insulin. And then when we're administering it, some of you are like, okay, Jennifer, I've given insulin. I got it. I know how to do this. But it's really important that we understand that we only give regular insulin through that IV. Very important, very high yield for that board exam, as we hear this getting tested on quite a lot. Everything else we're giving sub-Q or can be given sub-Q, and we want to make sure that we are rotating sites. It's really important that our client isn't giving themselves their insulin in the same site all the time because it can cause this thickening of the skin. And that doesn't sound like a big deal until we start to think about absorption. So when that skin is thickened, the absorption is altered to the point where the client is not going to be getting all the benefits of that insulin. Something else that's really important here is right here. Syringes are measured in units, so we never want to be using a non-insulin syringe to draw up our insulin. You hear all the time of students that come back to the preceptor, and the preceptor says, "Did you give the insulin?" "Yep, I gave the whole 4 milliliters." You meant units, right? No, I gave the 4 milliliters. They are using the wrong syringe, and that could cause some really big problems. So we want to make sure when we're using or giving insulin, we want to make sure that we are giving it with an insulin syringe. We do not want to give expired insulin. So we want to make sure that those are dated appropriately. And remember, the only cloudy insulin that we should see is NPH. If anything else is cloudy, we need to throw it away. It's not any good. So let me know in the chat, where are some areas that we might go ahead and administer some insulin? What are some of those places that we might give insulin? The abdomen, okay. Yep. The back of the arms, the thighs. Yep. Really anywhere you can get some good fat content so you can pinch up that skin, right? And what is the angle that we give insulin? Somebody remind me. What's the angle that we give insulin? Okay, so I'm seeing some 45 and I'm seeing some 90. So for those that are saying 90, when would I give insulin at a 90-degree angle? Because there is a time if my client is obese, you got it. So there are quite a few sites that you can see here. The back of the arm, the abdomen, those are the most common. There is some space back here, but honestly, I've never given it in that area, and my clients don't give it to themselves in that area. You can get it, you can give it in kind of this upper buttock area. Now, I have a family member that has a pump, and sometimes they will put it in that area. It's just more comfortable for them. I don't understand how that could be comfortable. You'd be sitting on something all the time. But listen, whatever works for our client, we just want to make sure that they are giving them in an area that is that's appropriate. Okay. All right. We got just a couple more. We are going to go ahead and look at, let's look at this one here. This medication is a synthetic thyroid hormone that's used to treat hypothyroidism, a condition where the thyroid gland does not produce enough thyroid hormone. The thyroid hormone is crucial for regulating various metabolic processes in the body, including energy production and utilization, body temperature, regulation, and normal function of the heart, muscles, and other organs. What medication am I? Man, you guys were fast on this one. I'm impressed. Nice work. You're right. Many of you got this one. It is levothyroxine. So our levothyroxine is given for those clients who have high or low TSH. Which one is it? Is it high or low? So hypothyroid actually means that their TSH is elevated. So that's when we're going to give that levothyroxine. All right, let's look at another one here. This is an oral medication classified as a sulfonylurea, and it's commonly used to treat type 2 diabetes. It works by stimulating the beta cells in the pancreas to produce more insulin, and that helps lower blood sugar levels. This medication helps increase the body's sensitivity to insulin, allowing it to be more effectively regulate the blood sugar. What do you think? What medication am I? It's a sulfonylurea. Ooh, I'm seeing some great answers here. You got it. It is glipizide. Very, very good. Nice work. Now, what if you're sitting there and you're saying, Jennifer, I'm really struggling. I'm trying to pass the board exam. I have no idea where to begin. Let me recommend our Sure Pass combo. Now, this offers you our Q Bank with over 3,000 questions, NCLEX style unfolding case studies. We have our on demand videos that are there to explain those difficult concepts. And we also have our 3-day live review. This is an opportunity for you to get that high yield information to pass your NCLEX before you take it. We offer it the first Wednesday, Thursday, and Friday of the month. It is a 9 a.m. to 4 p.m. Central Time each of those 3 days. And we're going from fundamentals all the way to specialties, trying to break down that information so it's less scary and just that high yield information. All right, so I have one more question for you before we head out. This medication is a synthetic corticosteroid medication that belongs to a class of drugs called glucocorticoids. It's used for a wide range of medical conditions due to its potent anti-inflammatory and immunosuppressive properties. This medication mimics the effect of cortisol, a hormone produced by the adrenal glands, and can influence a variety of processes in the body. What medication am I? What do you think? Ooh, remember, we are in endocrine. Ooh, I'm seeing some great answers here. Nice job. Way to go. Maybe just a couple more seconds here. Many of you are getting it. Yes. So this is a group of medications called glucocorticoids, but the actual medication is prednisone. Nice work. Now, when it comes to prednisone, this is a medication that we can use for asthma, for COPD. It's decreasing inflammatory mediators, and we can give this in a couple different ways. We can give it inhaled. It can, help with those symptoms, but it can also cause oral candidiasis. So we want to make sure that they're rinsing their mouth afterwards, or we can give it oral route. Now, this is a medication that we're going to taper off. It's not something that we want our client to be discontinuing abruptly. Awesome work today. I am incredibly impressed by your dedication, by your resilience, by your commitment to your learning. And here at Archer Review, we are incredibly proud of you and love to be a part of your nursing journey. Whether you're just starting out or maybe you're over here, you're getting ready to become a nurse practitioner. We have a community for you, and we can't wait to see you at one of our next webinars. We're incredibly proud of you and we're cheering you on along the way. Remember, anything that's worth doing is worth doing right. And you're showing up, you're showing out, and you are committed to success. And so are we. Have a great week, everyone. We'll see you back next time. Take care.